Knock, knock, knock. Hi, my name is Kyle. I got an order from the doctor. We're gonna be doing tray suction today. Okay. I have my equipment here already. I'm just gonna set it up. I have my saline, my extra tray kit. Let me actually put that in here. I also have my ambu bag and my tray dilator and my goggles and my mask. Okay. Alright. Hand hygiene. Okay, Mr. Doe. Would you mind stating me your name and date of birth again? Okay, let me check. The original? Okay. Alright, Mr. Doe. What we're gonna be doing today is we're gonna be doing tray suction. We're just gonna have the gunk removed from your tube so you're able to breathe better and you have less chances of getting infected in there. During the procedure, if there's anything that goes wrong or anything like that, just raise a hand, left or hand, it doesn't matter, okay? Okay. We're gonna be closing the curtains for privacy, and from here on out, what we're gonna be doing is assessing Mr. Doe's. We're going to be assessing his respiratory rate, vital signs, the lung sounds, his effort, and oxygen saturation. Okay. Since I'm a right-handed, what I'm going to be doing is I'm going to be having getting my suction ready up, and so I can put it over on the side, so that I won't have a hard time since I'm a right-handed. For you to set this up, you're of course gonna turn it on the regular. You're gonna put your thumb here. You're gonna dilate it to 80 to 100 merc, and the moment you have 80 to 100, you put it on intermittent, and you put your suction there. The next thing is we're gonna be really informing on the catheter or the site we're using. So if we're going for nasopharyngeal, we're going to be using 5 to 6. We're using lube on the tip. For oral pharyngeal, we're using 3 to 4 inches. Here on out, I'm going to be putting my mask on and my goggles on. Put my goggles on and everything. And the next thing really is we're gonna be putting Mr. Doe on a comfortable position for us to work with, so in the long run we don't hurt our backs or anything like that. Of course, put Mr. Doe also in a 45-degree position, which will help out during the procedure. And of course, we're gonna be putting the bag on his chest, or not the bag, but the pad on his chest, so that whenever we're doing suction, there's no we won't ruin his clothing or anything like that if there's gunk that comes out. And then of course make sure it's 45 degree. Okay. We're gonna be putting this on, and while you are putting this on, it's okay for you to unclip this already. Okay. Again, we already have our goggles and our mask on. The next thing we're going to be doing is we're going to be setting up our sterile field. The things we're going to be looking for is the expiration date of our saline and our equipments, and both of our equipments are good. The next thing is we're going to be setting up our sterile field. So we're going to be opening this. We're going to be taking off the box, and the moment you take the box, spread it, okay, and you pour the saline. Make sure your label is facing the other way whenever you're pouring, okay? So you want to do a dip off, okay, and then okay. And now what we're going to be doing is we're going to be gloving up and getting our catheter out, okay? Okay, make sure you do not contaminate your sterile field. Okay, putting the gloves on, taking it off. Okay, the next thing is this, and the moment you lift your thumb off, you can put that back. Okay. The next thing we're gonna be doing is we're getting our catheter. And for this, what we're gonna be doing is we're gonna be wrapping this around your dominant hand. Okay? And from here on out, I'm gonna be contaminating my left hand by touching the tube. Okay? I'm gonna be connecting it through. Alright? Unwrapping this. And what we're gonna be doing is we're gonna be rinsing it off. So you're gonna be suction, 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 and you wrap this around again. From here on out, what we're gonna be doing is we're gonna be asking Mr. Doe to hyperoxygenate. The way we do this is we're gonna be asking him to take a deep breath, 3 to 4 slow, deep breaths. So we're gonna be asking Mr. Doe, would you mind taking 3 to 4 slow, deep breaths for me? Okay, good. And then you can remove the mask here, and we're gonna unwrap this. Make sure you make attention so you are not gonna be contaminating your catheter. All right, so when we're going in 3 to 4 inches, okay? And right, and then we're going out, suction, 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 suction. Rinsing, suction, 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 suction. Wrapping this around your dominant hand, putting this back in. And whenever we're doing this, we're gonna be asking Mr. Doe to hyperoxygenate again, but we're gonna be waiting 30 seconds to a full minute. The moment we wait for 30 seconds to a full minute, then we're gonna be asking him to take 3 to 4 deep breaths again. Mr. Doe, would you mind taking 3 to 4 slow deep breaths for me again? Okay. And you unwind again, 3 to 4 inches, and we're going in. And suction, 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 suction when you're going out. Suction, suction, suction. And wrapping that around, putting the mask back on so he is able to breathe. Okay, from here on out, I'm gonna be removing my my gloves and everything. Okay, and so after the procedure, while we're doing this, we're gonna be assessing his, or after this, we're gonna be assessing his vital signs. We're gonna be assessing his lung sounds, respiratory rate, and oxygen saturation. And then, of course, we'll get Mr. Doe in a nice position and make sure he's in a safe position as well. Okay, lower the bed down. Okay, hand hygiene, and here now, just don't forget to turn off your suction. And of course, before you do all of this stuff, you're gonna be documenting. Okay, you're gonna be documenting the tolerance of the patient during the procedure, pre and post of vital or lung sounds lung assessments. You're gonna be dating coca on the specimen whenever we get the suction out, like the residue, and we're gonna be doing the catheter size for documentation. And of course, make sure that you have all your stuff out so it's all clean and everything. And we're gonna be again documenting this, and we're gonna be checking on Mr. Doe in about 2 hours or whenever the doctor wants us to do another tray suction.